Okay, well, it's another episode of Khalidia, and we have a special guest today, Dr. Golin Samari, assistant professor at Columbia University. A number of accolades. If you'd like to introduce yourself.
Sure.
Your resume is longer than we need to read, but it has a lot of
Sure.
Yeah.
Happy to. I'm Golin Samari. I'm an assistant professor at Columbia University's Mailman School of Public Health. I met Khalidia through our graduate program in Islamic Studies. So I have a background in both Islamic Studies and public health, and I'm a population health demographer by training. And so I kind of use that combination of training and skills to really focus on social inequities in health when it comes to Middle Eastern and Muslim populations, both in the US and in the region. And so I'm probably most known for my work in that space.
I have sort of an irrelevant question, but what is the mailman part of that? Like, I saw that earlier.
I think they name schools based on donation amounts.
And there was a mailman.
Someone named Mailman.
There was a mailman that donated to the school.
Yep, that is what it is.
Yeah.
Like the UCLA school where I graduated from was the Fielding School because of Jonathan Fielding's donation, so it was named in his name.
Sure. I mean, I get that. I just like is mailman a name, or is that a title?
No, it's a last name.
Mailman?
Yeah.
That's an unfortunate last name.
I mean, there's worse though.
Yeah, I suppose. Hey, we recently talked to Ronnie, and we met Ronnie when we were in Beirut. We lived in Beirut, and as when I was your chaperone and translator.
You were my chaperone in Beirut in what, 2010?
Yeah.
And we met Ronnie.
Yeah. And we met Ronnie, and I also did some data entry, I recall.
Oh my gosh, you remember
for
that we lost that survey data and you helped re-enter it.
Yeah.
At AUB.
Yeah. So I lended a hand.
Yeah, you sure did.
In any case, so we go back a long ways.
Yeah, more than a decade.
There's a lot of history there. But it'd be nice to talk about what your current research is and what you're working on currently.
Sure. Yeah. So I, as you know, because we go back so far, used to do quite a bit of work focused on women's health. I still do quite a bit of work focused on sexual and reproductive health. But in 2015, when I finished my PhD and was getting started on my postdoc years at the University of Texas at Austin, I noticed that there were a lot of anti-Muslim hate crimes going on that year. In particular, there was a murder of 3 Muslim students at UNC, and then there was the incident with the bomb clock in Dallas, with the kid taking a clock to school and being accused of making a bomb and being expelled. And it just really dawned on me that I was sort of positioned in this place where I had had training from a lot of scholars who had looked at racism and health. And I also had Islamic studies training. And so I was like, I'm one of the few people that's actually able to speak out about why Islamophobia and anti-Muslim racism is really a health issue and a public health issue. So since then, I've had sort of an ongoing line of research in that space. And because the research is so limited, I did like sort of the theorizing and the conceptualization. And now I do a lot of work that really tries to like measure it and quantify and really operationalize it. And so a lot of my current work is really, using tools that we have available to actually like capture what's going on and really show people that it has a health impact. So I had a recent paper that, for example, looked at the 2017 Muslim ban and how it affected women's birth outcomes. And there was a real big increase in preterm birth among the women from the banned countries, which is a terrifying health indicator because we know that that is a predictor of lifelong health and poor health. And so just this one really structurally discriminatory policy had a profound impact on women's health. And so I do stuff in that space, and along the lines of other social inequities in health. So I look at migration-based inequities, particularly in the Middle East and North Africa, and I continue to look at gender-based inequities as well.
So for someone who's not in your field, what do you mean when you talk about quantifying it, and like what is that exactly? For someone that doesn't know anything about that particular field.
Sure. So like a lot of times we talk about like measuring things or, proving things. And in social sciences, we have sort of two ways that we create proof or show associations. And one of them is through quantitative research and one is through qualitative research. And so I do both. Qualitative research is really asking Muslim communities in the US about their experiences with discrimination, what they do to combat discrimination, how it affects their health, how it affects how they socialize in the world. And so it's really bringing those voices forward. On the quantitative front, it's really about different ways of measuring it. So for example, a lot of our hate crime statistics are from the FBI, and they're imperfect because of the way that we talk about race ethnicity or measure race ethnicity. So for example, a lot of Muslim communities are categorized as white because Iranians and Arabs are categorized in the white category. And so the hate crimes, like if you just look at raw hate crime statistics, you don't have a full picture of exactly how many anti-Muslim sort of hate crimes there are. I think it's really underestimated. And so I try to capture like, how can we measure anti-Muslim hate in other ways? And so one of the ways is like scraping data from Twitter, for example. So like, are there periods of time where there's more like hateful tweets? Is there Google Trends data that corresponds to increased hate? Using different tools like that to actually create sort of quantifiable numbers around these things, and then associating them, using statistics to then associate them with various health outcomes.